If your legs feel cold all the time, even when the rest of you is warm, if they cramp up in the middle of the night for no reason at all, if they go numb or start tingling after just sitting for a little while, there's a good chance it's not your muscles, it's your circulation. And after 60, this becomes a lot more common than most people realize. Today I'm going to show you the one exercise that vascular doctors actually recommend for this. Not stretching, not massage, not compression socks. One simple movement done sitting right where you are that targets the real cause. Stick with me because I'm also going to walk you through the warning signs that mean this is more than just poor circulation and when it's time to see a doctor. Let's talk about why this gets worse as you age. Your legs are the farthest point from your heart, so blood has to fight gravity the entire way back up. When you're younger, your leg muscles do a lot of that work for you. Every step you take, your calf muscles squeeze. Picture a turkey baster or one of those old rubber bicycle horns. Every time you squeeze it, whatever's inside gets pushed up and out. That's exactly what your calf muscle does to the blood pooling in your lower leg. Doctors call this the calf muscle pump. It's basically a second heart located in your lower leg, except this heart doesn't beat on its own. It only works when you move. But here's the problem. As we age, we move less. We sit more. Our calf muscles get weaker, and that pump starts to fail. At the same time, something else is happening inside your arteries. High blood pressure, high cholesterol, blood sugar issues. All of these become more common with age, and all of them cause plaque to build up inside your arteries. Think of a garden hose. When it's brand new, water flows through it freely. But over the years, if gunk and mineral deposits build up inside the walls of that hose, the opening in the middle gets smaller and smaller. Even with the same water pressure, less water makes it out the other end. That's exactly what plaque does to your arteries. The tube narrows from the inside, and less blood makes it all the way down to your feet, especially in the legs since they're the farthest point from the pump. Doctors have a name for this narrowing. It's called peripheral artery disease, or PAD. And it's estimated that PAD affects a significant number of adults over 60, many of whom don't even know they have it. So you've got two problems happening at once. Less pumping action from your muscles, and narrower arteries for the blood to squeeze through. That combination is exactly what causes cold feet, cramping, numbness, and tingling. Now, let's clear up a few things people get wrong. Myth number one, rubbing or massaging your legs fixes circulation. It might feel good for a minute, but it does nothing for the actual blood flow mechanism. Myth number two, compression socks alone solve the problem. Compression socks can help support your veins, but they don't replace muscle activity. They're a support tool, not a fix. Myth number three, you just need to walk more with no other explanation. Walking is great. In fact, it's one of the most studied treatments for poor leg circulation there is. But most people don't know how to walk for circulation or what to pair it with. I'll get to that. Here's the exercise vascular specialists point to again and again. It's called the ankle pump. Some people call it the heel-toe raise. It directly targets that calf muscle pump we talked about. Here's how you do it. You can do this sitting in a chair or lying down with your legs out in front of you. Start with your feet flat on the floor, like you're standing normally. Now, keeping your knees still, lift both heels up off the floor. Only your heels move. You're rising up onto the balls of your feet like a tiny tiptoe. Hold that for 1 second. Then lower your heels back down, slow and controlled. Now do the opposite motion. Keep your heels planted on the floor and lift your toes up toward your shins. It's the exact same motion as pressing and releasing a gas pedal in a car. Toes down, heels up. Then toes up, heels down. Hold each position for 1 second before switching. That's one full cycle. Do 15 to 20 of these in a row. Rest for a moment. Then do another set. Aim for 3 sets a few times a day. especially if you sit for long stretches. This movement mimics exactly what your calves do when you walk. It squeezes the deep veins in your calf. That squeeze pushes stagnant blood back up toward your heart. It also helps pump oxygen-rich blood down into your feet and toes. Studies on the calf muscle pump show this mechanism is one of the most important tools your body has for lower leg circulation. The beautiful part? You can do this at your desk, in front of the TV, even in bed before you get up in the morning. No equipment, no gym, no getting up off the couch. Now, if you want to take this further, here's what to add. First, short walking breaks. Every 30 minutes of sitting, stand up and walk for 1 to 2 minutes. Research on peripheral artery disease has shown that regular walking, done consistently, can meaningfully improve pain-free walking distance and quality of life for people with circulation issues. Second, elevate your legs when you rest. Prop your feet up above heart level for 10 to 15 minutes. This uses gravity to help blood drain back toward your heart. Third, stay hydrated. Thicker blood moves slower. Water helps keep blood flowing more easily through narrow vessels. Fourth, watch your sodium and processed food intake. These contribute to the same plaque buildup we talked about earlier. None of these replace the ankle pump. Think of them as support for the main exercise. Now here's the part I don't want you to skip. Poor circulation can be a simple, fixable issue, but sometimes it's a sign of something more serious. See a doctor if you notice any of the following: leg pain, cramping, or a tired, heavy feeling that shows up specifically when you walk a certain distance and then eases off once you sit down and rest. That's called claudication, and it's a classic sign of PAD. Any cut, blister, or sore on your feet or lower legs that isn't healing the way it used to, even after a couple of weeks. One leg or foot that feels noticeably colder to the touch than the other side by side. Skin on your foot or lower leg that looks unusually pale, shiny, and stretched, or takes on a bluish tint. Numbness or tingling that stays constant instead of the kind that comes and goes when you shift position. These aren't meant to scare you. They're meant to help you catch a problem early while it's still very treatable. PAD, when caught early, responds extremely well to exercise and lifestyle changes. The earlier you address it, the better your outcome. So to recap, your calf muscles are a second heart for your legs. After 60, that pump often weakens, right when your arteries may be narrowing too. The ankle pump exercise directly targets that pump. 15 to 20 reps, 3 times a day, sitting or lying down. Pair it with short walks, leg elevation, and good hydration. And if you notice pain while walking, wounds that won't heal, or a leg that's cold and pale, get it checked out. Your legs have carried you this far. A few minutes a day can help them keep doing their job for years to come. If this helped you, share it with someone in your life who complains about cold feet or leg cramps. And I'll see you in the next one.